I decided to pursue to work with the RMS cluster because it was a lot of like-minded people that are very inspiring and supportive in a field where there's not that much research going on, and the collaboration between each other is very fruitful. Traditional masculinity affects men's help-seeking behaviors in several ways. For example, the reluctance to seek out help is very common also in Switzerland or in Germany. But also the presentation of symptoms is so different, and often they mask their symptoms behind, for example, aggressive behavior or irritable behavior or excessive working. And so for many clinicians it's still difficult to identify it, and it's a lot of training to specialists also to better identify the specific symptoms that are rather characteristic for men. I think we definitely need to tackle depression in men from both sides, from the biological perspective as well as from the psychological or from the gender perspective. And so it's a real goal of our research that we do studies that really research parallel research questions. For example, testosterone levels, how do they change over time in therapy, do they increase? And also how do, for example, traditional masculinities might change if we apply a male-specific psychotherapy. I'm very interested in studying psychotherapy tailored to men because I realized in research there was a lot of psychotherapy research going on with women. Most of the primary studies have at least 60 or 70% women in their trials. And the effectiveness for men was not that clear out of them, although large meta-analyses show no sex differences or gender differences. This is not that obvious, and I think we can massively improve when we tailor psychotherapy to men so they will not end up in bad places. Especially in the German-speaking area of Europe, there's more stigma related to psychotherapy. The notion that men are more reluctant still to psychotherapy, they're definitely more concerned to keep their problems with them, and it's also very seeable in the research literature that men are not increasing in the uptake in psychotherapy. So we need to do more work there that has already been done in other countries, and we're lacking behind there.